Okay, now let us look at the classification of anemia. We can classify it in different ways, but one of the classification, we can classify it according to the morphology. Morphology means how does a red blood cell look like. So here we are going basically to look at its size and its shape. Or it can be classified according to pathology. Any cause of the cause of anemia, which is pathological, is increased demand, where, for example, this mother is pregnant with twins. Decreased production, that is when we have like a problem with the bone marrow, or increased loss, for example, in cases of hemorrhage, when the mother has bled. So we can also classify anemia due to pathology. Or severity, we can also classify it according to severity. There we shall talk about mild, moderate, or severe. Or we can also look at the etiological classification, and here we shall look at 2 or 3. One, due to blood loss. So we are going to classify anemia as hemorrhagic anemia. And hemorrhagic anemia can be acute, which can occur due to an accident leading to blood loss. So here, an accident, here we can say like PPH, that is when the mother has delivered, or a pregnant mother having an accident. This mother will have what we call acute hemorrhage, or chronic hemorrhage when small amounts of blood is lost continuously from the body. For example, in cases of hookworm infestations or chronic ulcers. And when I try to go back in acute hemorrhage, we said we also classify the cells, the red blood cells, on how they look like. That is, their size and shape. So for acute hemorrhage, the cells are normocytic and normochromic. What does it mean? That these cells are very normal when you look into the microscope. They have the normal shape and they have the normal color. Normal shape is normocytic, normal color is normochromic. So if a mother bleeds due to acute hemorrhage, when you look at the kind of red blood cells through the microscope, the cells are very normal. So what does it mean? This mother may just need another replacement of cells. And also when you look at chronic hemorrhage, the cells are hypochromic and microcytic. What does it mean? That on visual inspection through the microscope, when you look at red blood cells of a mother who has had a chronic hemorrhage, the cells will look light, that means hypochromic, and they will be small, microcytic. For example, if a mother has hookworm infestations, the hookworms will continuously feed on the heme or on the iron and the folic, which makes the red blood cells. So we said the heme is the one which makes a red coloration of the red blood cell. So now if the hookworm is feeding on the heme, it means the cell will look hypochromic, the cell will look light. And because it is the folic which helps in the size, growth, and stature of the red blood cells, if this hookworm is feeding on it, it means the cells won't be able to grow big enough, so they will remain microcytic. So that is classification due to blood loss. It can be either acute hemorrhage or chronic hemorrhage. And on microscope, these cells will look differently. For acute hemorrhage, we shall have very normal cells with a very normal color, but on chronic hemorrhage, the cells will be light and they will be small. And now we can have another classification, that anemia due to impaired red cell formation. And we said due to disturbance of the bone marrow function, due to deficiency factors and others necessary for erythropoiesis, we may have what we call iron deficiency anemia. So this means there is not enough iron in the blood, and iron is needed to form hemoglobin. This is the most common cause of anemia, especially in pregnant women and in children. Then we can also have megaloblastic anemia. This is when the red blood cell is too large due to lack of folic acid or vitamin B12. Previously, we talked of folate deficiency anemia and vitamin B12 anemia. And these two anemias, this anemia will be called megaloblastic. And what do we mean? These cells will be extra large because they lack folic acid. And the books say that one type of megaloblastic anemia is called pernicious anemia. And in this time, there is a problem of absorbing vitamin B12, which is important to making red blood cell. Then we can also have aplastic anemia. This is failure of the bone marrow to make the red blood cell due to conditions like infections, genetics, cancers, etc. The bone marrow may fail to reproduce the red blood cells, and this mother will be having what we call aplastic anemia. And then we can also have anemia due to excessive red cell destruction, and we call it hemolytic anemia. And under hemolytic anemia, we have the thalassaemias, which is a group of blood disorders which cause the bone marrow to make abnormal red blood, abnormal hemoglobin. So thalassaemias are types of cancers which invade the red bone marrow and it fails to make a normal hemoglobin. And also we have sickle cell anemia, which is a type of hemoglobinopathy, an inherited type of anemia in which the red blood cells are abnormally shaped. And this leads to their excessive breakdown and a short lifespan. So, when we go to morphological classification of anemia, we said that morphology, we basically look at the size and the color of the red blood cell. So one classification of morphological classification, we have the normocytic, normochromic. Normocytic anemia, it means the hemoglobin content of the cell is in the normal range. Normocytic, characterized by inappropriate decrease in hemoglobin, packed red blood cell volume, and the number of erythrocytes per cubic millimeters. So here we have two words. Chromic means color, cytic means size. So this mother might be present with anemia, but on examination, her cells are normocytic and normochromic. It means the cells are very normal, of a normal size and of a normal shape. And this is very common in hemorrhagic anemia, when the mother is having a decreased hemoglobin count due to blood loss, actual blood loss. So the remaining cells may be less than 11 grams per deciliter, but on examination through the microscope, they look normal, of a normal color and of a normal shape. So this will give us the management as we would like to manage this mother. So another morphological classification is microcytic hypochromic. As the name suggests, it is the type of anemia in which the circulating red blood cells are small in size, that is microcytic, and they have a decreased red color, that is hypochromic. The most cause of this anemia is decreased iron reserves in the body, which may be due to multiple reasons. So, when we don't have iron, what does it mean? We said iron is a key factor which has the recipient of oxygen. And when oxygen attaches on iron, we get a hemoglobin, which makes the red coloration of blood. And now if a mother has less iron in the body, it means we shall have less receptors for oxygen, and therefore our blood cells will look light, hypochromic. And because they will look light, they may also not grow to the expected size. That is why we call them microcytic. And then another term under morphological classification is macrocytic. Macrocytic is the condition when the red blood cells are very large. These red blood cells, first of all, they are not fully developed. They are prematures and they do not function the way they should. This causes diminished oxygen delivery to the cells of the body, resulting into fatigue and low energy. This condition can be caused by vitamin B12 deficiency, liver diseases, alcohol consumption, and other cancers. So when a mother is having a condition which is depriving vitamin B12 from the body, the cells will look big. That is what we call macrocytic. And because they are too large, they may not function in their expected way. And then another classification, as we said, the pathophysiological, it will be due to increased demand, decreased production, or increased loss. But again, the World Health Organization also classifies anemia according to severity. That is, according to severity, depending to age and sex, as we did above. As above, in the first paragraph, like we said that mild anemia in pregnancy is 8 to 10.9 grams per deciliter. Moderate anemia is 7 to 7.9 grams per deciliter, and then severe anemia is hemoglobin level below 7 deciliters.